It's your boy. What's up? It's your boy Dr. Victor right here with Dr. Mercury in the house. Ciao, vezi facem. Deci stăm, ce?
Ok. Nu știu exact unde vreau să mă duc. Ok, încoată. Ok. What's up?
What's up? It's your boy Dr. Victor right here, and today with my good friend right here,
Dr. Mercury, neurologist.
and I'm a diabetes doctor, and today we team up in this beautiful podcast, diabetes and neurology, a good ring to it, like a superpower merged together and growing even higher.
That's right. Our patients agree, they work together.
Exactly.
And also we agree. We
Yeah.
have a lot of things in common, and we are really glad to bring to you a team up that will deal with medical issues during
Exactly.
this, we hope, prolonged podcast.
Maybe you're gonna learn something, maybe you're gonna laugh. We'll see. You know, it's an experiment right here.
Our main theme for this episode is mental health during the pandemic.
Exactly.
It's an issue that affects everyone, not just us doctors. But our domain is known for its stress levels.
Yeah,
Some are really
exactly.
high. We try to maintain a level of calmness even with our patients in order to encourage them a lot
Yes.
of times. So maybe we can just tackle a bit how we managed our own sanity during this period.
By the way, I'm a diabetes doctor here
Yeah.
in Romania, and you're a neurologist.
Yeah, the right. And funny enough, we met during
Yes.
your
My-
neurology session, I guess.
Yeah, the weeks that I am needed to do neurology, basically
Mhm.
3 months. And yeah, of course, neurology tackles mental health, of course, because you see it more often. But basically, every branch of medicine, it's important, the mental side and how you speak to your patient.
Yeah,
So I think whatever you do, medical wise, you need to know the mental side and your patient, how is he thinking, also your own mental health.
that's right. That's right.
Are
yeah.
you how are you coping with the stresses, and is your sane level in check?
Mhm,
Okay.
mhm.
So yeah, I think this could be a good subject. So for example, you at the hospital, what do you see exactly day by day in your neurology practice? Problems that you see related to stress or mental health with your patients? Did you see any common themes, or patients, what do they have trouble with?
Well, I didn't prepare for this particular subject a lot in advance, but I remember a study that we talked about a few days ago, that depression is encountered in 1/3 of all neurology patients.
Oh, okay.
And that does not include only the old patients that maybe feel a little bit abandoned by their family and deal with subjects and problems outside of hospital care, but also in the young patients, because our pathology is quite severe and disheartening when we put a diagnosis. Usually patients require a lot of support from all sources.
Yes.
So yeah, depression is the most common mental health issue. I didn't practice neurology before the pandemic, so I don't really know the effect the pandemic had on this
These type
patient,
of patients,
this
yes,
type
okay.
of patients. But I imagine that the feeling of isolation and not
Yes.
wanting to deal with your issues and trying to isolate yourself and
I
just
can exacerbate even more the
Yeah.
problems, if there were any problems.
yeah. So what about your patients?
Well,
You have the unique opportunity to talk about the period before
yeah,
the
well,
pandemic.
the funny thing is, even though I'm a diabetes doctor and I'm gonna do 5 years of practice studying different things and diabetes residency, I only studied 1 year of diabetes, like in 2019. I didn't see any diabetes patients on a specialized diabetes ward for like a year and a half. But I see a lot of diabetes patients in other like specialties. Example, for when I was your neurology ward, and I see usually when the patients that have diabetes, they tend to eat uncontrollably and a lot more processed food that gets their blood glucose even higher because of their stress. And of course, with isolation and with them hindering the different types of things that they could let off steam, they usually go to food because it's there in the house. You can easily order food, and then they come at the hospital and they say, "Oh, my blood glucose is not that good. I don't know why I'm not eating that much food." But actually, when you ask them and see, hey, let's try and do a journal of actually what you eat, then they realize, oh wait, actually I'm eating pastries every day. Yeah, I'm eating sweets almost every day. So there's a common theme, especially here in Romania, resolving your stress and your problems by eating. So, and basically in every other country, but especially here in Romania, I see.
I don't know about your grandparents, but mine, when they see me, I don't pretend I'm obese or have like a lot of kilograms on my weight, but I don't think I'm that skinny.
Yeah.
But my grandparents treat me like I'm a skeleton.
A healthy boy in Romania is a puffy boy. That's a healthy boy in
Yeah,
Romania.
yeah. And even then, he could eat a little bit more. Just
Yeah.
like his grandmother will always have just a special treat
Exactly. That the special pudding or
Yeah.
that special cake hidden.
that doesn't count. It just doesn't count. He can have as
Well,
much as he wants.
That's a good
Or
thing.
should. Yeah.
That's a good thing because think about it. If ever a famine break through, you will be safe. But if you're fit, think about that. You wouldn't be safe. So grandma knows best. We have to listen to our grandmas.
Camels have it right. You have to drink in
Yeah.
advance and maybe now eat in advance because you never know.
Exactly.
World War III might be around the corner, so
Yeah, but
you have to be prepared.
this is an interesting topic. What you said. I noticed this in my patients, and I wanted to ask if it's the same for you. It's a misconception with diabetes patients that they get fat or their blood glucose is out of whack and uncontrolled because of stress. Yeah, okay, stress indeed could raise a bit the blood glucose. Okay, because of catecholamine, so there is a process there. But usually they get fat and their diabetes gets out of whack because of stress. That's the first factor. But then the stress, they deal with it with food, and usually with tasty food. I never seen a diabetic, oh no, I'm so stressed right now, give me some of that broccoli right now to take off some steam. No, of course. So did you also see the same for you? When they're stressed, they go to certain behaviors or any misconceptions that you see that they're thinking, no, I'm 100% this is the cause for my ailment, but actually it might not be the case.
What I see is patients hating hospital food, and maybe that's not unwarranted because it really doesn't taste that good. But
Bland.
But it's just a bit more complex than that. Like they don't like the fact that they are separated from their homes, that they have to sleep in the same room with strangers. At the end of the day, that they're dealing with an issue that is really tough. So all these stress factors
that's right.
accumulate, and food that would actually be an escape is not an option because our hospital just offers bad food, and usually without salt, any kind of salt, barely tasting like anything. It's like I don't know.
One of the most bland foods indeed. Yes, that's true.
Something I don't know. It was like a paste I ate once that apparently astronauts use in order to gain like a lot of calories in a short period.
In the neurology world?
No. We don't have access to that kind of tech yet.
Future Elon Musk secret astronaut sauce.
Actually, I was in a museum, in a science museum, and they gave like this kind of, I think it was kind of a pudding. You put water on top of it and it expanded.
Okay.
It doesn't taste like anything, but it's actually quite healthy because it has all the nutrients and it's really compact. So you can take it like on the mountainside in a tree.
Nice.
And it really helps you.
And did you taste? No, you didn't taste it. You just
I just tasted it.
Oh, you tasted that?
Yeah, it was like
Give it from 1 to 10. Give it a score for taste-wise. 1 to 10. 10 meaning orgasmic.
Okay.
The best thing.
And 0 meaning no taste?
No, basically 5 would be a no taste.
Okay.
0 would be freaking putrid.
Give it a 4. Yeah,
okay,
give it a 4.
Okay.
It doesn't taste like anything.
Well, that's
anything
good. When you're hungry, that's okay.
Yeah,
For example, I know I love oats, oatmeal.
Yeah, yeah.
But oatmeal with salt is like a 5. It's the most blandest food on the planet. So you're basically like eating water. It's okay, it does the job, So it's
Yeah.
like, I think of it as the most neutral food,
Yeah, we go on a tangent like always, but like this escape route, the food escape route is barred, so
Okay.
they're we're returning to depression. They are just sad about their condition and that they can't have anyone to
Okay.
yeah. Usually when a patient is religious, I don't really believe myself in one particular religion, but
Okay.
I appreciate their kind of belief because it gives them an escape.
Okay.
It's quite rare to see a patient be quite positive.
So you see
during his,
in your patients, the one that are more religious usually get
Yeah,
along better with
yeah,
their stress,
yeah,
and they're more okay.
and they,
Okay.
they evolve in a better manner.
Okay,
So
that's good.
that's reassuring in a way because it demonstrates that any kind of stress relief that we can offer, and there are a lot of ways that we can improve our paramedical
Yes.
approach, are quite effective.
Yes.
We can see them in the patient's evolutions quite clearly.
Getting better
Yeah.
if with this fact. Okay.
And that explains why religion dominated Romania, for instance, and a lot of European countries for a lot of time during
Yeah,
history.
well, when you're suffering, it is a good escape and
Yeah.
a good tool to use, especially if you don't have any other
Yeah.
tool. So yes.
So yeah, and also I tend to appreciate that patients work with the physiokinetotherapy.
Okay. So you have this type
Yeah.
of therapist at your ward, at your
Yeah.
clinic and neurology. Okay.
And this is like this people, we have like two really professional individuals, and they make a whole lot of difference. They
Yeah, of
give the
course.
patients a lot more hope than we initially believed.
I think
when
they
we started
actually
working with them.
also at the same time have to be really good psychologists
Yeah.
to do their job really well. So they're like a combination, like a Power Ranger squad in one person.
Yeah.
Psychology and kinetotherapy combined, Yeah.
Body and mind, they work together.
Yeah, yeah. So
this is
also,
demonstrated.
would you agree that to be a good doctor, especially when working with patients, you also have to be really good in tune with the psychology side and understanding the way your patient thinks and
Yeah.
apply these
Yeah.
sort of things.
The fact that they are also good people and good psychologists
Yeah.
or good mental health instructors in a way.
Exactly.
Because all these barriers, these physical barriers that our patients encounter, are most of the times mental barriers.
100%.
And I think diabetes patients as well. Like,
for my specialty, I think that's like exactly 90% because diabetes, type 2 diabetes, of course, not type 1, which is autoimmune disease.
Yeah.
Type 2 diabetes is a preventable disease that can usually appears because of food factors, of course, processed food and activity. So it's a disease that can be prevented. So that's why the psychology for these patients and them being in okay mindset, not being stressed, and going to foods, tasty foods to let off the steam, it's the most important thing. I also work at a nutrition clinic, and I see when the person is in a more relaxed mind space, not that many stressors as before, as when the reason that he got overweight were present. Now he's maybe more relaxed, the stress has lifted, he's doing much better with the way he's eating. He's not even going with that much effort with the diet, but just he's more relaxed, he's doing physical exercise. Just by this alone, it's much better for weight loss, for his overall health, and for the people with diabetes. So related to stress and food and eating unhealthy things as an outlet, I think it's so important to actually talk to the patient on one-to-one and see a bit about his life, a bit about why is he stressed, what was the cause, the reason. Maybe you're gonna find out, also learn about him more and get in touch to him, learn about on a personal level, and he's gonna listen to you even better when, oh, this not doctor, this human is actually trying to know me, not just on
this
abstract
is
level.
a quality that I observed in your approach to the patient during our time in the neurology ward, during your neurology session.
Also about you, I saw you're really analytical, and with the patient you try to understand him and try and realize his motives, why his backstory, like lore, you know, because we play video games.
That's
And I
right.
think that makes you a better doctor when you actually know your patient.
That's right.
But-
We really try to do this. I observe likewise, of course. We put a lot of emphasis on the human part
That's
of
really
the
important,
patient.
I think.
And our system, when it's good and it's bad, it also encourages like a robotic
Yeah,
behavior.
that's so true.
Like
Treat the disease,
treat the
not
disease,
the actual person behind
treat
the
numbers.
disease. Exactly.
Like a lot of people put them in categories,
Yeah,
and
exactly.
like this kind of disease needs this kind of
Exactly.
approach.
I mean, of course, we can see the benefit in having some general rules about treating
Yeah.
certain diseases. Yeah, okay, that's good. But we should extrapolate from this and personalize for the patient, especially diet-wise, and giving some diet plans for my patients. No one patient is the same, and not one diet is gonna work for all people because everyone's different. He's gonna say, hate that type of food. So whatever, if broccoli is the best food for weight loss, and if he absolutely pukes at the sound of broccoli, it's not gonna work. So
Can you blame them? They look
Yeah,
like
broccoli
little alien on your.
yeah, but
on your
it's in mustard. Broccoli is actually really good.
I really like
With some
broccoli. I
vinaigrette.
just was playing the devil's advocate.
But
there.
you know what I want to ask you. I see you're passionate about the psychology side. Why did you choose neurology, and why did you choose med school, and not why did you not choose a psychotherapist path or maybe a psychologist? Why? Can you elaborate why did you actually go the neurology
yeah, sure,
path?
Sure. Began, I think, for me at least, with Dr. K. I really,
So
really,
healthy gamer GG.
yeah, Healthy
Yeah.
Gamer GG, of course. Like, how cool can you be to make a YouTube channel, speak to the gamers, but also be like an applauded psychotherapist,
Yeah, 10 out of 10 right there.
yeah, and also kind of a monk and a guru
Yeah, and a gamer at
and
the
a
same-
gamer at the
so
same time,
it's like this man is like the trinity of the universe. He's
Yeah.
like every you know, the last airbender.
yeah, of course,
He's like air,
he-
water, earth. He's like
yeah,
gaming.
he's the voice. He's the voice from the intro, you know.
Oh, I don't know.
It was actually his voice.
No.
But I wouldn't doubt it. Like
Yeah.
he's accomplished so much in his
Yeah.
life, and
So, by the way, for reference, if you are interested in mental health, you should search for Healthy Gamer GG or Dr. K, because you're gonna learn a lot of amazing
Yeah.
things. And
so funny thing, when I was like last year or maybe one and a half year ago,
okay,
I really started to look at his content and was thinking to myself, I want to help the patient,
okay,
but I want to help him on a personal level, and I want to do something that I actually enjoy, not just learn all these notions that I've already been bombarded with
Yeah, of
during
course.
med school. Like, do something that I actually like, I find interesting, the human mind.
okay.
It's like the most interesting thing for me.
Mm-hmm.
The problem is, in our country, mental health, and I don't think our country is the only one that deals with this,
Okay.
but Europe in general, I think, has a little bit of disregard for mental health, and they rely a lot on pharmaceuticals in order to deal with these issues.
Issue, okay.
Yeah, but not a lot with
Complementary stuff, the meditation.
yeah,
or
all that kind
learning,
of,
okay,
of
on the side.
extra stuff. So I thought to myself, realistically, I cannot become a psychotherapist or a psychiatrist, because I finished med school, and that would be the logical step,
Yes.
without
Limiting yourself.
Limiting myself
only
to
the
this
drugs.
and-
Okay.
yeah, and prescribing and closing my ears and my eyes to,
Okay.
to all this extra stuff, because my superior, my coordinator,
Would scold you every time. Stop
yeah.
with that meditation.
yeah, stop with that
Bulky.
nonsense. We
Exactly.
need to help him.
Exactly.
But what I have seen during my student years and psychiatry world, and also what I have heard by speaking to people who
Are psychiatrists?
are,
Residents?
are
Okay.
yeah, psychiatrist residents.
What's their opinion?
They don't really like it at first,
So, okay.
but as they grow older, they start to shut their mouth and just deal with it
so
and go forward.
okay. So do you think they start to like it, or they just become numb to the?
They become numb.
Okay.
They become numb and just find their happiness and their personal victories
through
somewhere
other
else.
branches. Okay,
Yeah.
that's a bit sad, but what can you do?
Or they do like a psychotherapy training
Right,
in,
okay.
in parallel, and they start to use that skill in a small private
Okay,
endeavor.
Private practice, yes.
Yeah, in a private practice, and focus on a little focus group, and that's it.
Yes.
So I didn't want to become like that.
Okay, and so why did you reach the conclusion of neurology?
Yeah, so I thought, okay, so we can't deal with this larger issue yet, but we can deal with an organic principle, like the brain is affected in a certain way.
Okay.
We can help that patient with uh, with treatment that is already researched and it's in continued review.
Yeah.
And really modern, becoming more and more modern with the years. But also, I can bring my passion for the human mind and my compassion uh, with every patient. Because as I said before, they're
everyone
really
is different, and you can learn.
Yeah, and also our patients are really in need. I think our neurology patients are in need of a compassionate
Yes.
person. And
I think every patient in any
Yeah.
branch basically needs this.
Yeah.
Someone to actually know how to listen to them and to do active listening
Yeah.
and get them on a personal level.
So in order to branch my plan, I'd like to finish neurology,
Yeah.
focus on this for a while and see how well it resonates with me. And afterwards, maybe do like a psychiatry training afterwards, in order to help them in both ways. And also maybe
so you want to become a super saiyan, basically. You have neurology, and then you have ascended to even the psychiatry.
I just want to put like my name and afterwards neuroscientist or doctor in neuroscience, because I think neuroscience in a lot of countries is recognized as a doctor of the whole package. You know,
can you
mind and also brain.
In our country, neuroscientist.
In our country, only by doing both neurology and psychiatry.
Okay.
But in other countries, like for example, I'll give you, I think Denmark and the Nordic countries, they do like one kind of training, and they become like a neuropsychiatrist. That's the term.
Okay, my man, Mercury. How do you let off steam? Because we talked about stress in these difficult times. You know, being medical practitioners, learning all these from all these books and reading studies. How do you relax after a hard day at hospital and at work?
Well, that united us as well. Our passion for video games. That's right. So why video games? Because I think they're wonderful pieces of media that you don't just consume and afterwards forget about.
Yeah.
Or eventually put up on a screen and that's it.
They like put a small scar in your soul.
Yeah, that's right. Because we're talking about neurology, so it's reflexes. You just do something, an action, again and again, and a certain part of your mind is forever ingrained with that information and that reflex act. So when, I don't know, you defeat, I'll give a video game example that we both love, like Bioshock, right?
Yeah.
I just made a video about that, but when you first defeat like Dr. Steinman, the first boss of the game, you remember that because he tried to kill you on the corridors.
He's a memorable character in the game.
Yeah, and also he scared you. These actions made you remember the fight, made you, absorb it even more. So that's why video games are superior to any other kind of media in our.
Yeah, in my opinion also. And like what exactly do you play right now? What video games?
I try to invest my limited time right now for a Mass Effect playthrough.
Yeah.
I don't know about you, but when I try a video game, I try to like.
To completion? Or?
Yes.
Okay.
100% it.
So you want to, when you go into a video game, you go full on 100% completion.
Yeah.
You're not going to another video game and then going back to it.
And that's the problem. I go 100% on a video game, and then I stop, and then I go 100% on another video game, and I never finish them. It's a real problem. But
so we are procrastinating even in the good things in video games.
That's yeah. So everyone, calm down. Procrastination is a way of life.
So
Remember this.
some Mass Effect, the trilogy.
Yeah,
So
that's
you're
right.
playing all of them, or going through in order.
In order, yeah. I'll try to master them all.
Well, me also, as you know, we started the playthrough of Mass Effect 1 because it's the first, and it's also I played it like 10 years ago, and it's a nostalgic factor also.
How do you find it so far?
It's really good. I remember it now, the shock and amazement when I first played it 10 years ago, and the amazing story. I don't know about you, but I I really appreciate stories in video games because they're, as you said, a different type of media that can tell a beautiful story in a different, more engaging way. Like,
That's right.
I don't think you can attach more to a movie character or TV show character than a video game character, because you play that video game character, you're in it deep with his
you
problems.
become
So,
that character
exactly.
for a bit.
So you feel the sad and amazing parts of the story even more
Yeah,
when
that's right.
doing this.
I feel that as well.
So related to relaxing and letting go of steam, I know this for me. I'm so happy when I also play video games and I play with someone that I care about. It's even better. It's like two in one. You're also relaxing, making jokes, and also playing a video game. So it's like, for me, I think it's the best use of my time for relaxing. And I wanted to ask you this: well, what for you? What did you notice that per hour invested relaxes you the most? You're like, yeah, that 100% got me in the zone.
Well, I gotta say, video games are a good way of relaxation, but they are quite time consuming. So
Yeah.
if I'd like something that just fastly disconnects,
Exercise.
this disconnects me, it
Yeah.
would be exercise. It would be, but you know what? I'm gonna cheat. I'm gonna introduce a video game that also
that's cheat.
makes you,
You
work out.
You open the console controls and you're like,
Yeah.
cheat, you cheated, God mode on.
Of course.
Yeah, that's so true. I didn't play that much active video games, but I think that they're so fun.
Yeah.
Like,
So I'm gonna plug this one
Yeah.
because I talked
So-
to you about this one before.
what did you play?
It's a Ring Fit Adventure.
Ring Fit Adventure, yeah.
It's really cool. I recommend it to anyone who wants to cheat and also just wants to like trick their own body.
Yeah.
Their video game
More
body.
active, yeah.
Yeah, and just activate the synapses that work usually in a video game, but make you work out and forget about the fact that you're working out.
But by the way, Ring Fit, we're ready for the sponsorship right now. So anytime
Yeah.
where calls are opened, so we're waiting. It's okay.
So the first 100 of our subscribers will get nothing yet, but
Exactly.
maybe in the
We're hoping.
future.
Yeah, maybe like batteries for the Ring Fit, like $10 or whatever.
It doesn't work on batteries.
Oh, okay.
That's the nice part.
That's
It
nice.
uses your Joy-Cons, you know.
Oh, okay. Then not even the batteries. So $0 for the first 100 subscribers, but then unlimited potential.
Of course.
So,
yeah,
yeah.
that's right. So yeah, working out. What about you?
Yeah.
I know that you love to work out.
Yeah,
as well.
I also, again, for time invested, and when you're on the go, I think working out and exercise is the best.
Mhm.
Like, for my build up as the person that I am right now, I think exercise played one of the most essential, most important roles. So I wouldn't be the man that I am right now without exercise. It relaxes me so much, and when you giving a great sweat, you're like more relaxed. You're like a different person. You can have one of the most horrible days ever, but if you end the day with something that you sweat, it's gonna be after like at least for half an hour. You're gonna be so zen. Also, the same is I know this. I'm gonna ask you if it's the same for you. If you start your day with some exercise, again, usually the day just goes much better.
I'd say yes, but I'd never do it.
Oh, okay. Then you
So-
should try it. Wake up at 5 a.m.
Yeah,
It's a bit hard, but
Our parents knew best, you know.
Yeah.
They-
when they're working on the fields, 5 a.m. ring,
of
eat
course.
the.
Yeah, they were working on
omelet.
the fields, or they were walking through the snow to reach
Yeah.
their school.
Exactly.
Those kinds of stories that I grew up on.
By the way, what do you think was the mental health 100 years ago? Like when not any of this overgrown technology. What do you think? 100 years ago.
It's a really interesting question because I hear a lot during my day, and
Yeah,
usually
yeah.
it's
Back in my day.
yeah, it's like 45 plus years old.
Yeah.
They say we didn't have time to get
Worrying about mental health.
Yeah, yeah, yeah.
This weird concept.
This is something modern.
Yeah.
It never happened
Yeah.
before. I don't think it never happened, but the outlet of letting everyone else know about your issues
Yeah.
was so much more limited.
Narrow, exactly.
Yeah, like only your closest friends would know, and even then, I think you'd worry about what they would think, and
Yeah.
you would limit your own exteriorization of
Do you think
that sentiment.
But do you think they were more stressed 100 years ago than now?
I think there's something to say. Did you ever play Stardew Valley or any kind of Harvest Moon like games?
Yeah, I did play.
Yeah. So you know that the whole concept is that doing simple work like working the field,
Yes.
cooking something, taking care of a household, things like
Yes.
this, tend to make you more stable and happy in the long run, and that working in an office, maybe in a hospital, or
Yes.
things that are quite rigorous and
Heady, you mean, with using the
yeah, cerebral, and
Okay.
also maintain a lot of connections with,
okay.
with other people,
Yes.
and working in a team and having a boss and all this kind of modern concepts.
Yes. It's
They
more
were
stressful
demonstrated
right now.
that
That's
they're-
the same.
yeah.
I think also.
So yeah, I think that mental issues are much more frequent now because
Today.
of our way of life that
Yes.
is apparently more connected, but actually more disconnected.
Exactly. 3,000 friends on Facebook, but -5 friends,
Yeah.
real life friends.
Yeah, we hear about it more because we have a lot of channels in order to
Yeah.
to show that. More.
Also, to your point, maybe it was there were some mental health issues, but again, not having the channels that we have and media outlets to know that the problem existed. You couldn't have known the problems. That 100% there were same problems back then, but the benefit, let's say nowadays, is because of communication outlets. You can find out of a problem much easier because you just Google it. Oh, this person also has this problem. What a neat thing.
And
Not alone.
that really is a neat thing if you
Yeah,
think about it.
that
Because
is a
Dr. K really connects people
Exactly.
with his work, you know.
Leave a comment if you want us to also start a Twitch channel.
Let's throw it into the universe and we'll see
Exactly.
what happens.
How about we talk about a basic usual day in your practice in the neurology world? What do you think? How is your basic usual day?
So we start our day by going to the, how would you call it, like the doctor's meeting.
Okay.
Like
the report room. I
the
don't know.
report. Yeah, like
The meeting. Sounds like
So-
a meeting room.
yeah. My specialty is known for its grueling overnight shifts.
Okay.
So that's why when you are part of this shift, it's like your obligation to attend
These
the
beautiful meetings.
these brief meetings during the morning.
No, I said these beautiful meetings.
I wish they were brief, but they're actually beautiful. Yes.
no, that's nice. I see what you did there.
So we attend this brief meetings, and
Yeah.
we talk about the cases that happened the night before,
The inpatients that just were admitted and okay.
of course, and also it's a good way of knowing what kind of pathology they have.
By the way, at what time do you have to be at the hospital?
Yeah, so this would start at 8,
AM?
maybe 8 or quarter past 8. We discuss these cases, and based on the pathology, based on the type of suffering the patient has, he is redirected to a certain doctor.
Okay.
That's the beautiful thing of our section. Like we have specialists in different kinds of problems.
Okay.
So you can like sense the kind of going that the patient will have in the following days, and redirect him to someone who
Appropriate,
knows
cause,
who
okay.
knows what to do next. That happens in most days. This meeting attending
In the morning.
in the morning. Yeah.
Well, that's the best way to start a strong day with an amazing meeting the first thing. So,
Yeah. A lot of pressure, but it's quite
Yeah.
nice. You see a lot of cases in a fast way, so you absorb a lot of information.
Okay.
Then you have your patients, your daily patients. Me as a resident, I have the duty of seeing them each and every day, do a whole neurology exam,
Okay.
see what happens next, what kind of evolution they had from the previous day. We see the patients, we see their blood sampling, their investigation results, things like that.
Okay.
And afterwards, we talk to our
Supervisor, like doctor.
supervisor, the doctor that we are attributed to, and he once again sees the patients and asks specific questions in order to test in a way
Your knowledge.
and your understanding of the patient, but also to simplify in a way his or hers work. Because
Okay.
a big part of your help is that you see the patient through and through, but the doctor can just go and punctuate the issue head on
Okay.
and approach it like that.
How many patients do you see per day?
Yeah, so it's something like maybe four or
4 patients. Okay.
yeah,
And
4
do
or
you think
5,
that's
something like that.
okay time for
Yeah.
neurology patients a day? That's okay.
That's okay for me. During my first few months, I thought it was a horrible way to maintain a relationship with a patient, because the work was not something that I found too easy at the moment.
Work, okay.
Yeah, and I thought that I had too little time left
For the
for the
patients.
patient
I
themselves,
understand.
and a lot of time was invested in the whole bureaucracy that
Bureaucracy part of the
of the
hospital
work.
work,
Yes,
yes.
of course. And nowadays that I some
you're more
something
efficient
like,
with
yeah,
this type of work,
I
the bureaucracy part.
I kind of absorbed the bureaucracy in my blood now, and
Okay. I also noticed you while working, and I see you're very thorough with the patient.
yeah, I try to be.
You try to.
I try too hard, but I don't succeed.
No, no. You actually try to find out their life story, and that you have. I think that helps a lot to form a connection and a rapport with the patient.
I try to do this in my future encounters as well. So I think I didn't change that much in the following months after you left, for example. But I became more efficient, and so
More efficient. Okay.
I find that
with the patient or with the boring, tedious.
the boring things. But now I can still use that time with the patient and go home at a normal hour, which is important.
Yes. By the way, I don't think it's bad to be efficient with the patient, because this is also important to ask the right questions.
Yeah.
Because I saw some specialists, especially young specialists, that yes, they stay a lot with the patient, but they ask the worst and the most stupid questions on the planet.
Yeah.
That they don't
Want to give
actually
an example?
and they don't actually get anywhere. So I don't necessarily think that when you're staying with the patient an hour just to find out about their job or their work, then it's actually good.
I find it really funny that some doctors are really personal with their questions to the patients, and sometimes they are too impersonal.
Yes, exactly. But it's hard to find the balance. And it's so hard.
It's really hard. Yeah. You need to be approachable and build trust with your patient, but not be too
pushy and nosy. Exactly. But it also, I think, it differs from the patient. Some patients you can see, you can see they're more distant. It's not that good for you to make a connection with them, to become too close and to ask, hey, by the way, what's your 3-year-old Bianca doing? And they'll be like,
talk about that with your friends, not with your patient.
While there are other patients that I also saw one patient that they just love to talk and about her life and about her children, her grandchildren, and tell you just 1 hour about her knitting adventure. Yeah. So there are different types.
But you know what? I think that at the end of the day, the patient will admire you for your efficiency in treating their disease.
Of course.
Separated from everything else, from the daily discussions, and maybe that the doctor was too abrasive or too short with his approach. I think that at the end of the day, if he did his work well,
if he treat me,
I think that he will be left with a good impression overall.
And speaking about the schedule, usually at what time do you finish work at the hospital? So you're a first year neurology resident.
Yeah, that's right. So it's not. I didn't really work for a long period of time to prior
Yeah.
to this, and it was quite the impact to have normal working hours.
Yeah,
Like
full
all my friends, which are non doctors,
Okay.
were talking to me about 9-hour shifts and
Yeah.
actually earning money and not having time to do what you want. And I was laughing in their face. I didn't know about that. I mean, yeah, med
Like
school
what
is tough, but you
Yeah.
don't really work. You study and you
Yeah.
go to
Yeah,
university.
that's true.
But
That's true. Yes.
yeah,
And basically, I think in one way we not waste, but we invest more times with our education, so we can be more, so we can have more free time after the.
Yeah.
So basically, more sacrifice in the younger years for a bit more time when working.
That's right.
And you're,
so
yeah.
that's a nice part of our doctor careers. We usually finish somewhere around 3 o'clock in the
Yeah.
afternoon.
But I'm 100% guess there's gonna be some days where you come
Yeah.
home like 6 or
The
7.
exceptions are not really exceptions, are becoming something like
Occurrences.
like half of the times.
Yeah.
So it's like good days and bad days, but they're not bad in the way that I don't enjoy what I'm doing. It's just that sometimes there are a lot of urgent cases and
Yeah.
urgent things that you can't let for the next day. You need to resolve them
Yeah.
then.
I imagine a resident that doesn't really care, and at a certain point after 3 o'clock he's like, my job is done for today, and I'm gonna leave right now. Like, bro,
Yeah.
don't do that. No,
We see that a lot. We see that
Yeah.
a lot. Like you were an
Yeah.
exception, like a resident that actually cared for his time there. But a lot of residents that come for the neurology session but are not that into it,
Yeah.
like they couldn't care less.
Yeah.
They just want to go home,
Yeah.
and they're like, if they could become one with the wall, they would just
with the wall.
they would
That's
just
like
they would just fuse. You know.
you are like Yoda for a second. One with wall, you become must.
Of course.
Yeah, indeed. If you're like a specialty that completely is has
parallel.
nothing to do with that branch, like neurology or whatever, okay, maybe let's say,
Yeah,
or
yeah.
you have other projects that you are doing at home. Okay,
Sure.
I can understand that. But yeah, at the same time, I guess you would be a little bit pissed as a resident when you're just alone, and but you also should have another 2 helpers,
Mhm.
residents that actually don't help.
Helpers.
Yeah, helpers. So yeah, I know
Mhm.
what you're saying.
But yeah, like this is a cautionary tale for our younger audience, like people who think about med school or starting
Yeah.
residency. Like actually try to make the most of your time there.
Yes, yes,
And
exactly.
I think every experience has a way of teaching you something, even the most boring ones. I think if you look
Yeah,
from a certain perspective, you can find
a lesson
something
right there.
of-
Exactly.
of value there. Yeah.
By the way, because we are talking about why did you choose the neurology road? For me, the reason why I chose the diabetes side is not necessarily because I just love diabetes pathology, but because I'm most passionate about human health and exactly more specifically nutrition, human nutrition, prevention of diseases, and I am of the opinion that you can do this with proper nutrition, proper healthy lifestyle.
Mhm.
And I noticed that the best specialty that is related to this with nutrition and prevention is diabetes. And because in our country it's not just diabetes, because I don't think think it's only one country that the specialty is called diabetes. In any other country it's branched with endocrinology. So yeah, but right here it's called diabetes, nutrition, and metabolic diseases. So it sounds really fancy
Yeah.
and complex, and it has nutrition in the title. So I thought, man, this must be the thing that is most related to.
They must respect nutrition a lot.
Exactly. They must like involve nutrition in every practice, every hour, right?
Mhm.
No.
No.
No, but it was funny because the first year of my diabetes residency, I was the one with the patients that always stayed after hours. And okay, Mr. Johnson, let's talk about your carb intake and about blood glucose. And everyone was like, Mr. Dr. Victor, why are you always speaking so much about with the patients about nutrition? Just leave them be. Stick to the basics, and it's okay. But I actually love this side, and I think if I talk to 10 patients, and at least one is like 10% better off about talking about nutrition and healthy eating and healthy lifestyle and prevention. I think that's win. So yeah.
And I think that is a basic concept that Dr. K was talking about, the AOE healing. You know?
Yeah.
Like treating a patient, but even if he is not the one listening, the other patients in the room, in that case, listen. And maybe something
it's gonna stick.
It stick, yeah.
Exactly.
Or maybe not them, but maybe you will become a more experienced speaker in that way and understand the psychic of the human and the patient better.
That's another good point. The more I think we practice speaking with the patient and trying to understand him, the better we are gonna be at this skill. Because it's a skill. You're not like, born with.
We're still learning. That's the funny thing. We're like 26 and 28.
28 a week ago.
Yeah. So like we're still learning at this age. So I think our training years are developing quite nicely at the moment.
It's not over. It's like an ongoing learning path.
Mm-hmm.
Yeah.
Something like that. Yeah. So so talking about all this made me really hungry for some reason, because you know.
What are you gonna eat at this hour, my man, Dr. Mercury?
So that's what I wanted to ask you about, like
No,
is it really true that eating after a certain hour is actually bad for your habits and your health?
Yeah, it would seem from the latest studies that eating your food in the first part of the day, so the calories, most of the bulk of your calories in the first part of the day, so daylight, is more healthier. And people that do this usually have less disease and live longer.
Because you have more time to digest and
I don't know exactly. I don't think they won't 100% know the physiology behind this and the mechanism of
action. If we look at the hormones, it makes sense.
It could be because of the circadian rhythm and the hormones, and you being adapted to eating in daylight. Because of course, if you're gonna hunt or whatever along the evolution and eat, you're gonna do it by daylight, not at night. I think it's because of the hormones and the circadian rhythm and the hunger hormones, satiety hormones, and things like that. But yes, it would seem that if you care about longevity and disease, it would be best to not have the bulk, so the most of your food, the calories, at night.
Yeah, we're all about that. But the longevity, I mean. So one more question. I'm still feeling hungry, so another curiosity. Yeah, so it's like this myth between neurologists.
Okay.
As I told you before, we have this long overnight shifts.
Yeah.
And people tend to eat a lot during those overnight shifts. Like you see the patient, you deal with all kinds of crazy stuff, and then you feel really hungry. You just grab the first thing that comes to your hand.
Usually healthy and processed food, right?
Yeah, of course. That's the only thing we have there.
Carrots
it's
and
a hospital afterwards.
I'm guessing you're saying unprocessed, unhealthy, junk, quick food.
Usually burgers, pizza, things like that. And it's like this myth that neurologists during overnight shifts do not gain weight. Like all those calories don't count during the overnight shift.
Yeah, well,
how true would that be?
It's interesting that you say this to me because a new study pointed out that no, I'm joking. It's actually completely false.
You almost got me there.
But for 3 seconds, you're like, bro, I'm onto something. Eating at night, a beautiful thing. No, fortunately, actually, it said that you put even more weight at nighttime. Yeah, and I also, by the way, the patients that I have at the clinic, at the weight loss clinic, most of them have unhealthy habits and unhealthy eating patterns, and most of them that are overweight, most of their meal is at nighttime. They barely eat anything in the daylight because they don't have that much time. Maybe some snacks, quick snacks, and I think you can imagine what type of snacks that are quick and throughout the day.
Yeah,
it's not broccoli or carrots. And at nighttime they come home and they just ravage the fridge. They destroy the fridge. So it's not a good.
During the night, you say?
The nighttime, yeah. The dinner time basically is the only or the biggest meal. Yeah.
So the preconception that Romanians are all vampires is true.
Yeah.
We like to eat at night.
Yeah, and
can do.
that's true. And also that's why I always carry some garlic with me
True.
because I want to be safe.
Which I
from
hear is quite
expensive.
healthy.
Yeah, yeah. Oh my god, it's so healthy. I made a top 10 healthiest foods on the planet 2 years ago that has like
Link in the
200
bio. Link in the bio.
200 views. You better watch it. No, just like 200 views. But and I put the garlic I think on number 2 or 3 because I studied the literature. It's so amazing. It has so
Okay.
many benefits. The only downside is the bread.
Yeah, what can you do? If a girl loves you, she loves you for your
Garlic bread
Gar-
also.
garlic taste and also the garlic appreciation that
Exactly.
you
and
both share.
and she better appreciate that you're gonna block the vampires. So
Yeah.
she better appreciate that because here in Romania you have to be careful.
Yeah, about that, I think a game we should play together.
Yeah.
Like you said, like bonding time over video games is really cool.
Vampire.
Vampire.
Yeah.
That's right.
How is it pronounced? Vampire. Vampire.
I've heard people talk about it in different ways.
Okay.
But we, being Romanians, we really need to choose
our roots.
one way and pronounce it like we used to.
Vampire.
Like vampire.
Yeah, it sounds
That's
a bit German. Vampire.
Yeah. Another idea, we being
You
Romanian,
played it?
is Resident Evil. You know,
Oh,
the
Resident
last one.
Evil also.
Yeah, with
Oh, yeah,
Dr.
with-
Dimitrescu. Not Doctor.
Dumitrescu.
Lady
Dumitrescu. Yeah.
Dimitrescu. Like, pronounce it right, guys.
Yeah.
It's not that hard.
Leave a like if you want us to play some Resident Evil.
Yeah.
What is it? 7, right?
No, this would be 8.
Oh, 8.
Mhm.
Or some vampire action.
Yeah, so Vampire, why talk to you about this one?
You played it?
I played it and it's really fun.
Yeah.
There's a lot of medical issues that are presented in this game.
Okay.
I think it would be a great topic even for one of my videos.
Okay.
I didn't present my work, but what I try to do on my YouTube channel is I take like a video game or a piece of fiction and I try to
Dissect it. Medical
dissect it.
wise.
Nice term. Yeah, dissect it for its medical essence, you know,
Yeah.
and try to like really lean into the whole what is true and what is fiction,
Fiction. Yeah.
and how much do they get right from their
I think that's
their
such a good branch to specialize in. You know, combining games with the medical side. I think it's really fun.
Thank you.
And you can find in so many games these aspects, the true things, the fiction and the actual medical lore and facts in it.
Yeah, and Vampire got it right. That
Yeah.
was what I want to talk
About the vampires existing in Transylvania.
No, it's actually in London during
Oh,
the.
okay.
It's another pandemic. I don't really remember. I think it's the Black Plague. No, the Black Plague is something is in the medieval times. No,
It's
it's
the 17th century, well, 16th century.
Yeah.
So it's after.
No,
that.
it's somewhere immediately after the First World War.
Oh, okay.
It's I don't remember the kind of disease that they were talking about, but it's like a pandemic and the whole of London is closed off.
Okay.
And
Is it an RPG or?
it's an RPG,
an RPG?
yeah.
Okay.
And it has like a lot of RPG elements, like branching storylines and a whole complex skill set, and it's really nice. I compare it to the gameplay of Bloodborne, like how it plays.
Okay, nice.
But discount Bloodborne. The gameplay is not the
Discount
struggle.
Bloodborne.
It's not like the gameplay is not the really good part. The good part is the
Okay.
story and how they got the medical facts right. Like the patients that are there presented are actual really real life cases, and
Nice.
you have like a lot of ethical issues and decisions that you have to take.
Okay. So it's actually story focused.
Yeah,
In
yeah,
a sense.
a lot
You
of
sh-
story.
You should, when you do the review or when talking about it, you should say my take on it. Discount Bloodborne with
Of course, yeah. Like you have to be honest with your audience.
Yeah.
Never let them lead them on a wrong road.
But the important question is your character damaged by Gal Usturoi?
No, it's
Okay.
it's
So
treated
it's
like
not true to the Transylvanian folklore.
Yeah, I think it's even discredited, like laughed about. Yeah, some
Oh,
they have
that's
like a
not-
segment about this. Yeah, no, but damage from sunlight is real.
Okay.
Crosses have effects on you.
So basically, you can't go in the sunlight in the cities and
Mhm.
things like that. Okay,
That's
That-
right,
That's
and-
actually an interesting game element that you only go in the night.
In the night,
Time.
and you only work night shifts, like a doctor's nightmare.
Oh,
And
okay.
and it's
So
explained.
you're an actual doctor
Yeah,
in the game.
you're an actual.
We should play. We should
yeah,
play this at some
how
point.
do you call it? Like a cardiovascular surgeon,
Okay.
and you had invented, like during your human days,
Okay.
a technique called the blood transfusion,
Okay.
and you are a vampire now. So
Okay,
you're
so
the
that's,
master of blood.
Oh yes.
And it's really cool because you can cure your patients, like actually give them cures for common disease like migraines, things like this.
Yeah.
But this brings their blood quality up,
Oh,
and
okay.
you can just drink it and take more XP and become more powerful as a vampire
So like
if you treat them
invest
right.
in their blood, and then
Yeah.
you become even
And
more
you
powerful.
can invest in them, in their blood for like a human would, like treating your patient and being a good doctor, or you can be nefarious about it and
This game sounds really fun.
yeah, and you can play like a psychopath, which is really
Yeah,
cool.
yeah.
I really love to. That's what I wanted to talk to you about, like the Mass Effect playthrough. Our Mass
Exactly.
Effect playthrough is
Yeah.
completely different from
We are
moral
goody,
choices.
Yeah, we're goody two shoes usually in real life, situations. But in video games, I think, as you said, it's sometimes fun to play as the complete deranged lunatic. So, and our character in Mass Effect is textbook sociopath.
Yeah.
Fun.
That was the goal. We managed to do it.
I think it's so fun when video games let you, play the good, beautiful, humane side, but also dabble in the completely deranged sociopath. So you're talking about video games you play. Mass Effect right now. What other games do you play right now?
Well, my Switch is my best friend, I think,
Yeah, really?
because it's so convenient, for I don't know, for a doctor, because we really are always on the move from hospital to our home and maybe other endeavors, and the time is limited. So being portable really helps.
That's a good plus. By the way, for me right now, dabbled in some Mass Effect with you on the playthrough, and as same as you're talking about, I also realized that I don't have that much time to put in a lot of hours playing a video game.
Victor has a lot more projects than I have right now, and I really am amazed sometimes that you managed to do them all.
It's the things that permit me to be efficient, like something like Battlefield 1, which I can just play 30 minutes
Instant
of a game, exactly, an instant, I'm in the match and don't need to attach to a story and wait for some more dull times, but I really want to get into an RPG, and I just searched the the last days on YouTube of some good RPGs, and this Vampire sounds really
promising,
good.
Huh?
Yeah, it sounds. I watched a review of I don't know if you know a person that does really good reviews.
I know where this is going.
Which he did a review Arantoni of Vampire, and it sounded really good from him the review in the game. So I think it'd be a good idea, and also a good idea for duo video, something like Vampire, because
it's in the works.
Yeah.
It's in the works. So what about you? What is your next project on YouTube?
Yeah. So for you, you're thinking about Vampire. That's I think that'll be a really great project.
Yeah, it's. I also read a lot, and I try to make a video about the books I read. So now Fahrenheit 451 is the next video on the way. Then BioShock, I think.
Another
BioShock video. I love that game, but
it's so good.
there's a lot to talk about, and my time is limited, as I said before.
Did you play BioShock 2?
No. It's the only one in the series
really
I didn't try.
Yeah.
I think I finished the first one when I was quite young, and then the third one I loved, the Infinite one.
Yeah.
So yeah, I'm gonna do like a whole playthrough, but give me time.
For me, the next videos I'm not 100% sure right now. Either something like weird, completely preposterous diets that people are adopting in the world, or again, I was thinking about something that I can relate also to video game, maybe medical related video game, and some random playthrough with that. I'm not so sure.
Well, maybe we can collab on that. I'll do my deep dive with the medical issues, and
I'm gonna talk about the fat people in the game. They're fat for a reason.
No. You can talk about the benefits of a blood diet.
Yeah,
for the human body.
I think there are actually people that drink not human blood, because that would be really wrong, but animal blood. They drink it like not even pasteurized or heated. So,
Okay.
but yeah, I'm not judging. I mean, everyone's entitled to
A good idea for
drink.
Yeah.
Some iron supplementation, natural iron supplementation. Because the pills can make you constipated, but the blood is so different. There's no constipation.
But I wonder, doesn't it really irritate your gastrointestinal
It
tract?
could. I mean, we are in a way, I think, engineered digestive system wise to eat meat and
Raw, not cooked.
yeah, but we're really poor, I think, at digesting raw meat. But I think we can eat raw meat and blood with because you can also eat like liver and things that have a lot of blood, and you can digest them. Okay, but of course you're gonna digest food much better if it's actually cooked.
Another good idea for you would be to talk about the evolution of human life, like how our diets evolved, and also our digestive system adapted to the diet.
That's also a good idea. I sort of made something like that with the carnivore diet, which I dabbled in the history of what did we eat 10,000 years ago, a million years ago. But that would be interesting to see the evolution of and the proponents of. The problem with this is, I noticed that there's not one common ground of what did we 100% actually eat a million years ago, 100,000 years ago. There's like theories and most likely this, most likely this.
I find it interesting that they look at the teeth of the of the persons to
they analyze
judge
the isotopes and the certain particles in the teeth, and they realize what they actually eat from those carbon isotopes and things like that. It's so amazing.
Like they use the same things for dinosaurs. I love dinosaurs, as you know.
I also like dinosaurs, and they're so. Can you imagine that to someone to make a game about eating healthy and diets and eating certain food and managing a person to not die with the type of diet. I think it would be like a Sims, something like a Sims, but more focused on what you eat and doing physical exercise, and then randomly you can get a heart attack in like 3 days in the game, like whatever. And
that sounds really cool. I think we have a real shortage of a video game based on medical facts.
Funny thing, I did a video on something like a medical hospital manager.
Oh yeah, I know the game.
2 Point Hospital, that's the name. And I really wanted in my hospital to have healthy snacks. And the only choices the game allowed me was some pretzels and some crappy snacks and some sodas. Bro, I want some carrots in my hospital, and they won't let me put my carrots.
It's almost like we are doomed to have trash
food even in video games.
In the hospital.
For example, I think you know this. In basically any video game, especially in Bioshock, you have crap food snacks that you eat, and they
like Ryan wanted to create the perfect world. What happened during the food department?
I think it's expensive to, and especially in the real world, to eat healthy food right now is more expensive than eating trash, horrible food. McDonald's, how would it be funny to be sponsored after 100 episodes by our enemy, McDonald's?
It's impossible. We just burned that bridge. Exactly. You're singing their song like that. So I think a really important thing would be to make like a recurrent topic. What we're playing, what happened, like something different that happened during our week, our medical issues.
Anything meaningful the last 7 days for you?
Yeah, a good question. Like I had an interesting patient lately.
Okay.
There's this young patient that was pregnant.
Okay.
And she came during her pregnancy to our neurology clinic, and we treated her for what was at the time polyradiculonephritis, like an inflammation of multiple nerves throughout her body, with lesions that affected her peripheral nervous system mostly. And the anti-inflammatory treatment usually has really good results. It goes straight to the lesion, to the inflammation point, and the results are spectacular. Like 3 to 4 days after the initiation of the treatment, the patient goes home walking on her own feet.
Okay.
And before that, she barely moved and was in a lot of pain. And she came back just 3 weeks after her
Treatment?
no, it was like she was treated somewhere in her 7th month of pregnancy.
Oh,
The
okay.
pregnancy was okay. She bore I think a healthy young daughter, and afterwards 3 weeks after the CSAC, she developed the same issues.
Oh,
Yeah,
okay.
but actually worse. Like she barely managed to come to the hospital. Like she was really bedridden, and she responded well to the treatment, but she
The second round of treatment.
the second round of treatment and her second visit to our clinic, she like developed an allergy for
The second time?
yeah, to the same treatment, like
Okay.
no difference on her arms and legs, or her whole body.
Okay.
A lot of small lesions, erythematous,
Okay.
like red, and we for the first time called an allergologist, which to us doctors sound like I don't know, like the kind of doctors that work to maybe the afternoon and afterwards go home and have like a relaxed life.
A sort
Like
of
that's
chill
the
life, yeah.
yeah, that's a preconception.
Yeah.
But you know, life likes to slap
Yeah.
you on the face when you have preconceptions. So no, this person, this amazing allergologist, came during her like on-call hours,
Yeah.
and was really prompt. It was like an allergologist urgency,
yeah.
which is quite rare.
Exactly.
And yeah, she treated the patient fastly, and
And she was okay.
she was okay.
Stabilized?
We tried a different treatment option with anti-inflammatory effect. She was okay. She went home, and yeah. So an allergology emergency. That was my highlight for the week.
And with a happy ending.
With a happy
actually.
ending. Yeah.
That's nice.
Mhm.
For me, I had this week at the clinic, at the nutrition clinic, a patient. I'm not gonna get too much into details, but it's interesting to see that it was again confirmed the fact that in our medical practice, usually the patients that are more severe, they're not gonna get specialized and personalized diets, because no one usually is gonna get too close to them and involve themselves with a risky, difficult, and complex patient and diet-wise, because this was a complex patient with some difficult genetic diseases, and I can imagine almost every type of dietitian and medical doctor just pushing them aside, and you just research and eat whatever you think it's right. But it's really difficult for this type of patient with protein, with exactly the nutrients. So I remember the fact that it's really important for someone. I'm thinking about going through with this path to know exactly specifically for difficult diseases what to give nutrition wise as advice, because it's difficult and you have to research a lot.
Yeah, you have to take into consideration all her current medications, the ones she took.
Exactly.
All
these rare conditions.
Adverse reactions.
Exactly. These rare adverse effects that can come up when having a difficult or not a complete nutrition plan. So it's pretty difficult.
Like,
but yeah,
I think that is the toughest part of the job, like doing your research for a case and also studying the extensive history of the patient.
Yeah.
Like sometimes they come with this huge dossier of
information
and
lore.
Yeah, of lore. Like I love to do it in Mass Effect, but come on, real life is different, you know?
Exactly. Just reading 10 pages about 1 week of hospitalization of a patient. Yeah.
We have to be more organized as doctors, I think, and
that's
have
true.
a uniform system that works together. Like
I see some doctors that are actually really I think you're pretty organized, but in general I think we doctors need to be more organized to have efficient workflow.
Yeah, sometimes these issues are not medical issues. Like different organizations are responsible for our own systems that we work on.
Well, my man, I think that was a beautiful start for a podcast. We talked about journey of things. We learned something new maybe about ourselves. No, but jokes aside, I think or some good subjects.
Yeah, we really like tackled medical issues,
Yeah,
the future of our podcast, and what are the topics that our people watching
Exactly.
can expect.
hey, you at
You
the
know
moment,
who you are.
Yeah, exactly. You know who you are. The confidence for our first one of your podcast is through the roof from Dr. Mercury in the house.
Yeah, that's
Yeah.
right.
Some nutrition side,
Oh, yeah.
some neurology side, bringing it all together, a beautiful sandwich. I think it was a fun podcast. I'm glad we started this podcast together, and we'll see each other next time.
See you. Keep on dreaming.
Keep on dreaming. Mercury and victory out.
Bye bye.